Hello, my name is Heidi Childs. This is my presentation for Nursing 5220. The title of my project is Breaking Barriers, Telehealth Postpartum. So the practice problem that my presentation addresses is inability of postpartum mothers to attend their postpartum appointments. The barriers to care for women with postpartum depression represent an urgent public health crisis. Because the 6 week postpartum appointment in the United States is generally when women would be screened for needing postpartum depression care and interventions. Skipping this appointment can have really life altering consequences. Postpartum women are 3 times more likely to have suicidal actions. And with the barriers they experience, sometimes they just fall through the cracks and are not able to attend their appointment and be screened for these needs and ongoing care. Some of these barriers specifically include living in rural areas where it's a really long distance to get to the hospital. The travel is just not feasible for them. Either they live really far, it's too long of a drive with a new baby, they're often still healing, and it just makes it very difficult for them to attend their postpartum appointments. The next barrier is unreliable transportation. Um, Motherhood is a very strong predictor of poverty, and unfortunately, that often includes lack of access to reliable transportation. So, if a mom just can't get there, it's going to be really hard for her to be screened for appropriate postpartum interventions. A third barrier to care is stress of newborn care, particularly for first time mothers. Newborns are an every hour endeavor, day and night. Particularly in the United States, great um, we don't have great parental leave or a great village, you might say. Women are often isolated and kind of left alone with the new and intense stress of trying to care for a newborn. Her own needs kind of get pushed to the back burner. Going along with that is lack of accessible or affordable childcare. Um, some women have family to help or have access to childcare, but the majority of women who have additional risk factors for postpartum struggles often also are the ones that do not have access to affordable or accessible childcare. Our PICO clinical question is a way of formatting this practice problem in a specific way to come up with an outcome and a measurable change. So for this particular practice problem, our PICO clinical question will be, in postpartum women, how does the implementation of telehealth appointment options compared to usual care influence the rate of attendance of postpartum appointments and screenings for postpartum depression? This is important that these factors are specific and also measurable so that we can know whether our practice change is worth implementing or if it needs some adjustment if we're not actually getting to the root of the problem. So that's why we use the PICO format to address the specifics of the problem. For this particular project, we used the search strategy of going to the databases CNOL and PubMed and then using specific search terms. For my project, these search terms included postpartum visits, postpartum care, barriers to postpartum care, maternal mental health, telehealth postpartum, postpartum healthcare inequities, and postpartum care. By searching these databases with these search terms, I was able to gather literature and primary research related to my question of improving postpartum care access for mothers. Next, we did a synthesis of the literature, which is finding consistent ideas that are reinforced throughout all of the literature that we reviewed. I came up with three main ideas that were consistent throughout the studies that I reviewed. Main idea one was telehealth implementation increases postpartum visit attendance. While not perfect, in every measure in all of the studies that I included in my project, telehealth did increase postpartum visit attendance. That looked different between studies. Some were a pre-scheduled telehealth visit 3 weeks postpartum. Some was just a review of when that is given as an option, how much of an increase was noticed in the ability of postpartum mothers to attend their appointment. But it was consistent throughout the literature that telehealth implementation does increase postpartum visit attendance. Main idea two was postpartum mothers face significant barriers to care. We mentioned a few of those at the start. Being from a rural area, having lack of access to reliable transportation, just the overwhelming and new stress of caring for a newborn, and lack of access to childcare are all significant barriers. The research and literature did mention a few others, which I didn't go into in depth, but there are additional barriers to care involving just safety of the area where the family might live, whether that child is medically complex adds another layer of difficulty, whether the mother is even familiar with what she might be experiencing. She might be having these feelings and not know what to call it when what she's experiencing is postpartum depression. It's hard to know what care to seek out or what to ask for if you don't know what is happening. Main idea number three was postpartum visits are a vital element of healthcare for postpartum mothers. As I mentioned earlier, at least in the United States, the postpartum visit is primarily when new mothers are screened for risk factors of postpartum depression. And if those are missed, it can be a really life and death situation for mothers that are already isolated, experiencing these symptoms, and then not receiving care because they are unable to attend their postpartum appointments and get these screenings. The next thing we'll talk about is our proposed practice change. So this is the part where we dive into what could we do different to make things better for postpartum mothers. The proposed practice change for my project was the integration of telehealth as standard of care postpartum, or at least the option for it. The integration of telehealth should be prioritized as standard of care to increase postpartum visit attendance and facilitate early detection of postpartum depression. For new mothers, often where coming into an office visit might just seem totally prohibitive and overwhelming if they knew that they just have to do a quick FaceTime call or a call on the phone. That's often much more bite-sized and accessible for them, particularly if they are experiencing more than one of those barriers to care that we discussed earlier. Next is our proposed change process using the ARC acronym. Implementing telehealth options for postpartum care is a rational practice change that addresses significant barriers faced by new mothers while improving access to essential healthcare services. So during COVID-19, telehealth was really expanded across the board, not just postpartum, for all care. And we can use that momentum to implement this change process. Using the ARC acronym, first the A will be ask a question. Our question is, can telehealth improve access to healthcare for postpartum mothers? Next is request a change. Implement training telehealth platforms as the standard of care postpartum. So that includes training our practitioners in both the platform that's going to enable them to have telehealth appointments, as well as the shortcomings of telehealth, of being able to do a full assessment, of building rapport over a call versus in person, where you have a little more access to body language and just a little more across the room assessment opportunity. But acknowledging that while telehealth is not a perfect solution, it is a huge bridge in the gap of mothers either not receiving care versus receiving care. Next is voice a concern. The concern is that postpartum mothers are slipping through the cracks with the current postpartum care model. And that is demonstrable through all of the research. They are a population that is not well served with the model that we currently have as standard of care. And finally is chain of command. And this involves going up through even the corporate levels of the healthcare system to ensure that insurance reimbursement is available for telehealth. Unfortunately, with all of healthcare, money is a main driver. So if we can ensure that reimbursements are given for telehealth in the same way that they are for in-person visits, that's really going to facilitate the ability of that practice change to be implemented. Next is our evaluation plan. A successful intervention should result in a noticeable increase in the number of women attending postpartum appointments. More women should be screened early for risk factors and symptoms of postpartum depression than were screened with standard postpartum in-person care. So we should be able to see very clearly that the rate of attendance is increased if our implementation is successful, and that the number of postpartum depression screenings is increased if our implementation is successful. In conclusion, it's clear from the research that I've done with this project that telehealth can improve postpartum healthcare. It does this by increasing visit attendance and facilitating early depression screenings for postpartum women. I really appreciate your time in hearing about my project, and these are the references that I mainly drew from to support the statements made in this presentation. Thank you so much.